Best supplements for seniors. What you need after 65. Introduction. Do you find it harder to stay energized, keep your bones strong, or maintain your overall health as you get older? As we age, our bodies need different types of support, especially when it comes to nutrition. The right supplements can help fill those gaps and support your health after 65. In today's video, we'll explore the best supplements seniors should consider for maintaining vitality and well-being. Be sure to leave a comment with your experience, and don't forget to subscribe to Health Every Day for more health tips and advice. Supplément 1. Vitamin D. Vitamin D is one of the most essential nutrients for seniors, especially after the age of 65. It plays a crucial role in maintaining bone health, supporting immune function, and promoting overall well-being. As we age, our bodies become less efficient at producing vitamin D from sunlight, and dietary intake may not always be enough to meet our needs. Supplementing with vitamin D can help fill this gap and ensure that your body has enough of this vital nutrient to function optimally. Why vitamin D works? Vitamin D is vital for the absorption of calcium, which is necessary for building and maintaining strong bones. As we age, our bone density naturally decreases, and we become more susceptible to osteoporosis, fractures, and joint pain. Vitamin D helps regulate calcium levels in the body, ensuring that calcium is properly absorbed by the bones and teeth. Without sufficient vitamin D, even if you consume enough calcium, your body won't be able to utilize it effectively. Research has shown that adequate vitamin D intake is crucial for maintaining bone strength and reducing the risk of fractures in older adults. A study published in the Journal of Clinical Endocrinology and Metabolism found that individuals with higher vitamin D levels had a significantly lower risk of falls and fractures compared to those with insufficient levels of the vitamin. In addition to its impact on bone health, vitamin D also plays a key role in immune function, helping the body fight infections and reduce inflammation. How vitamin D tackles bone health and immune function. Vitamin D's primary role is to support bone health by helping the body absorb calcium. Without sufficient vitamin D, calcium can't be properly absorbed from food, which leads to weakened bones and increased risk of fractures. For older adults, maintaining strong bones is particularly important to prevent falls and fractures, which can significantly impact quality of life and independence. Furthermore, vitamin D has a broader impact on overall health. It is known to regulate immune function by enhancing the pathogen-fighting effects of immune cells and decreasing inflammation. This is important because as we age, our immune system naturally weakens, making us more vulnerable to infections and illnesses. Supplementing with vitamin D can help boost the immune system and reduce the risk of autoimmune diseases and infections. Praktiske tips for vitamin D supplementation. Since it's challenging to get enough vitamin D from food alone, supplementation is often necessary, especially for those who don't get adequate sun exposure. Here are some practical tips to ensure you're getting enough vitamin D. 1. Consider taking a vitamin D3 supplement. Vitamin D3 cholecalciferol is the most effective form of vitamin D for raising blood levels of the vitamin. It's more potent and longer lasting than vitamin D2, the other form of vitamin D. Aim for a supplement that provides at least 600 to 800 IU of vitamin D3 per day, but consult your healthcare provider for personalized dosage recommendations based on your individual needs. 2. Get sun exposure safely. Vitamin D is known as the sunshine vitamin because your body can produce it when exposed to sunlight. Aim to get about 10 to 30 minutes of sun exposure several times a week, depending on your skin type and location. However, be cautious to avoid overexposure to the sun, which can increase the risk of skin cancer. If you live in an area with limited sunlight, especially during the winter months, supplementation becomes even more important. 3. Include vitamin D-rich foods in your diet. While supplementation is important, it's also a good idea to incorporate vitamin D-rich foods into your diet. Fatty fish like salmon, mackerel, and sardines, fortified dairy products, and eggs are excellent sources of vitamin D. If you follow a plant-based diet, look for fortified plant-based milks, such as almond or soy milk, or fortified cereals. 4. Monitor vitamin D levels. If you're unsure of your vitamin D levels, ask your doctor for a blood test to check your serum vitamin D levels. This can help determine if you're getting enough and if supplementation is necessary. Research supporting vitamin D. Numerous studies have confirmed the importance of vitamin D for seniors' health. A study published in The Lancet Diabetes and Endocrinology found that vitamin D supplementation reduced the risk of falls in older adults by improving muscle function and enhancing balance. Additionally, research from the National Institute of Health emphasizes that vitamin D is essential not just for bone health, but also for reducing the risk of cardiovascular diseases, depression, and certain cancers, making it a crucial nutrient for aging adults. By maintaining adequate vitamin D levels through supplementation, diet, and safe sun exposure, you can help support your bones, boost your immune system, and enhance your overall health as you age. Supplement 2. Omega-3 fatty acids, fish oil. Omega-3 fatty acids, commonly found in fish oil, are essential fats that provide a range of health benefits, especially for seniors. As we age, the risk of developing heart disease, cognitive decline, and joint inflammation increases. Omega-3s play a crucial role in protecting against these age-related conditions. Incorporating omega-3 supplements into your routine can help maintain heart health, improve brain function, and reduce inflammation. Why omega-3s work for seniors. Omega-3 fatty acids, particularly EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, are vital for maintaining brain health and cardiovascular function. These fats are known to reduce inflammation, which is a key contributor to many age-related health problems, including arthritis, heart disease, and cognitive decline. For seniors, omega-3s have been shown to support memory, mood, and overall brain function, which can decline with age. Scientific studies have consistently highlighted the benefits of omega-3s for brain health. DHA, in particular, is a major structural component of the brain and retina, and its deficiency has been linked to cognitive decline and an increased risk of Alzheimer's disease. Research in the American Journal of Clinical Nutrition has found that omega-3s help reduce the buildup of amyloid plaques, which are associated with Alzheimer's and can improve cognitive function in older adults. How omega-3s tackle heart and brain health. Omega-3s work by improving the function of cell membranes and reducing the levels of triglycerides in the blood. They also help lower blood pressure, reduce the risk of blood clots, and improve heart rate variability. These effects significantly reduce the risk of heart disease and stroke, which are more common as we age. In addition to cardiovascular benefits, omega-3s are critical for brain health. They help protect brain cells from oxidative damage, improve neural communication, and support neuroplasticity, which is the brain's ability to adapt and form new connections. Studies have shown that omega-3 supplementation can help slow cognitive decline, improve memory, and even reduce the symptoms of depression in older adults. Practicate tips for omega-3 supplementation. If you're looking to include more omega-3s in your diet, here's some practical tips. 1. Choose high-quality fish oil supplements. For those who don't eat enough fatty fish oil supplements are a convenient source of omega-3s. Look for a high-quality fish oil supplement that contains both EPA and DHA. A typical recommended dosage is 1,000 to 2,000 milligrams of combined EPA and DHA per day, but it's always best to consult with your healthcare provider for personalized recommendations. 2. Eat fatty fish twice a week. If you prefer to get omega-3s from food, aim to eat fatty fish such as salmon, mackerel, sardines, or trout at least 2 times per week. These fish are rich in both EPA and DHA, providing the omega-3s necessary for heart and brain health. 3. Consider plant-based alternatives. For those who follow a vegetarian or vegan diet, consider plant-based omega-3 sources, such as algae oil. Algae oil contains DHA and is a suitable alternative for those who do not consume fish. Flax seeds, chia seeds, and walnuts are also good sources of ALA, alpha-linolenic acid, another type of omega-3, which the body can convert to EPA and DHA, although not as efficiently. 4. Monitor your omega-3 intake. It's essential to ensure that you're getting enough omega-3s to reap the full benefits. If you're unsure about your omega-3 levels, ask your doctor for a blood test to measure your omega-3 index and guide your supplementation. Research supporting omega-3s. Numerous studies have demonstrated the positive effects of omega-3 supplementation for older adults. A large study published in Neurology found that higher omega-3 blood levels were associated with a slower rate of cognitive decline and a reduced risk of dementia. Another study in the Journal of the American College of Cardiology confirmed that omega-3s lower the risk of heart disease by improving cholesterol levels, reducing triglycerides, and lowering blood pressure. By incorporating omega-3 fatty acids into your daily routine, you can protect your heart, support your brain health, and reduce inflammation, all of which are essential for maintaining strength and vitality as you age. Supplement 3. Calcium and magnesium. Calcium and magnesium are two vital minerals that play a critical role in maintaining overall health, especially as we age. These minerals are particularly important for supporting bone health, muscle function, and heart health. As we grow older, the body's ability to absorb and use calcium and magnesium may decrease, increasing the risk of bone fractures, muscle cramps, and cardiovascular issues. Supplementing with calcium and magnesium can help fill these gaps and support your body's various functions. Why calcium and magnesium work? Calcium is essential for maintaining strong bones and teeth, as it is the primary mineral that makes up bone structure. As we age, the body's calcium stores deplete, leading to weaker bones and an increased risk of osteoporosis and fractures. Magnesium, on the other hand, helps regulate calcium levels in the body by improving calcium absorption and supporting its proper distribution. Without enough magnesium, calcium can accumulate in soft tissues and joints, which may lead to stiffness, cramping, and impaired muscle function. Both calcium and magnesium also play significant roles in muscle contraction and relaxation. Calcium helps muscles contract, while magnesium helps them relax. This balance is crucial for preventing muscle cramps and spasms, which can become more common as we age. Additionally, magnesium is known to support healthy blood pressure levels and maintain proper heart rhythm, reducing the risk of cardiovascular disease. How calcium and magnesium tackle bone health and muscle function. Calcium and magnesium work together to ensure the proper functioning of bones and muscles. Adequate calcium intake helps maintain bone density and strength, which is essential in preventing osteoporosis and fractures. Magnesium is needed for calcium to be effectively absorbed and utilized by the bones, ensuring that the calcium you consume is being properly used. Magnesium also contributes to muscle relaxation and helps prevent muscle cramps, a common issue in older adults. By supporting muscle function and relieving tension, magnesium can improve mobility and reduce discomfort associated with muscle stiffness or cramping. Additionally, magnesium helps regulate blood pressure, which is vital for heart health and overall circulation. Practical tips for calcium and magnesium supplementation. To ensure that you're getting enough calcium and magnesium, here are some practical tips. 1. Take calcium and magnesium together. It's often beneficial to take calcium and magnesium together because they work synergistically to support bone and muscle health. Aim for a calcium supplement containing 500 to 600 milligrams per dose and magnesium around 250 to 400 milligrams per dose. You can find supplements that combine both minerals in a balanced ratio. 2. Choose the right form of calcium. There are different forms of calcium supplements, and some are better absorbed than others. Calcium citrate is generally more easily absorbed than calcium carbonate, especially for older adults. If you have a sensitive stomach or low stomach acid, calcium citrate may be a better option. 3. Incorporate calcium and magnesium-rich foods into your diet. In addition to supplements, you can increase your intake of calcium and magnesium by consuming foods that are rich in these minerals. Dairy products like milk, yogurt, and cheese are excellent sources of calcium. For magnesium, incorporate foods like leafy greens, nuts, seeds, and whole grains into your diet. 4. Consider taking magnesium before bed. Since magnesium supports muscle relaxation and promotes better sleep, taking magnesium before bed can help improve sleep quality and reduce nighttime muscle cramps. 5. Monitor your intake. It's important not to overdo it with calcium and magnesium supplementation. Too much calcium can lead to kidney stones or calcification of soft tissues, while excess magnesium can cause diarrhea or other digestive issues. Always consult your doctor before starting a new supplement regimen to ensure that you're taking the right amounts. Research supporting calcium and magnesium. Numerous studies support the importance of calcium and magnesium supplementation for older adults. A study published in the Journal of Bone and Mineral Research found that calcium and magnesium supplementation can help increase bone density and reduce the risk of fractures, especially in postmenopausal women. Another study in the American Journal of Clinical Nutrition showed that magnesium supplementation helps reduce the risk of muscle cramps and supports cardiovascular health by improving blood pressure levels. In conclusion, calcium and magnesium are essential minerals that help maintain strong bones, muscles, and heart health as we age. By incorporating both into your daily routine, either through diet or supplementation, you can help support your body's vital functions and reduce the risk of age-related health issues. Always speak to your healthcare provider to determine the appropriate dosage and ensure that your supplementation is tailored to your specific needs. Supplement 4. Probiotics. Probiotics are live beneficial bacteria that support gut health, which is crucial for overall well-being, especially as we age. These good bacteria help balance the gut microbiome, improve digestion, and enhance immune function. As we get older, our digestive system may slow down, and the balance of bacteria in the gut may be disrupted, leading to issues like bloating, constipation, and poor nutrient absorption. Taking probiotic supplements can help restore balance in the gut, improve digestion, and boost overall health. Why probiotics work? As we age, the diversity of our gut microbiome tends to decrease, and harmful bacteria may begin to outnumber the beneficial ones. This imbalance can lead to digestive problems, weakened immune function, and increased inflammation. Probiotics help address these issues by replenishing the beneficial bacteria in the gut. They aid in breaking down food, absorbing nutrients, and maintaining the health of the intestinal lining, which is crucial for preventing leaky gut syndrome and reducing inflammation. Research has shown that probiotics can improve the digestion and absorption of nutrients, which is essential for maintaining good health as we age. Probiotics also produce short-chain fatty acids, which are beneficial for the gut and support overall metabolic health. A study published in the Journal of Clinical Gastroenterology found that probiotics can alleviate symptoms of irritable bowel syndrome, IBS, and other digestive disorders, which are more common in older adults. Additionally, they can help regulate bowel movements and reduce symptoms like constipation, which can be especially problematic as we age. How probiotics tackle digestive health and immune function. Probiotics work by restoring the natural balance of bacteria in the gut. They outcompete harmful bacteria and yeast for space and nutrients, thus preventing infections and promoting a healthy digestive environment. This helps improve the absorption of nutrients and reduces the occurrence of gastrointestinal discomfort, such as bloating, gas, and constipation. Probiotics also play a significant role in supporting the immune system. The majority of the body's immune cells are found in the gut. so maintaining a healthy gut microbiome is essential for overall immune function. Furthermore, probiotics help reduce inflammation in the gut, which is linked to a variety of age-related diseases, including heart disease, diabetes, and gastrointestinal disorders. By improving gut health, probiotics can also enhance mental well-being, as recent studies suggest a strong connection between gut health and brain health. A study published in Frontiers in Immunology found that probiotics could modulate the gut-brain axis and may even help alleviate symptoms of anxiety and depression in older adults. Practical tips for using probiotics. To reap the benefits of probiotics, it's important to choose the right supplement and use it consistently. Here are some practical tips for incorporating probiotics into your routine. 1. Choose a multi-strain probiotic. Different strains of probiotics have different benefits. A broad-spectrum, multi-strain probiotic supplement is often more effective than a single-strain product. Look for a probiotic that includes lactobacillus, bifidobacterium, and Saccharomyces boulardii, as these strains are particularly beneficial for digestive health. 2. Take probiotics daily. To support gut health, it's important to take probiotics consistently. Aim for a daily dose that provides at least 1 billion CFUs, colony-forming units, per serving, but higher doses may be appropriate for certain conditions. Always follow the dosage recommendations on the supplement packaging or your doctor's advice. 3. Incorporate probiotic-rich foods into your diet. In addition to supplements, you can get probiotics from foods like yogurt, kefir, sauerkraut, kimchi, and miso. Fermented foods are rich in beneficial bacteria and can help support a healthy gut microbiome. Aim to include a variety of fermented foods in your meals throughout the week. 4. Store probiotics correctly. Probiotics are sensitive to heat, moisture, and light. Be sure to store your probiotic supplements in a cool, dry place and check the expiration date to ensure they remain effective. 5. Be patient. It may take some time for probiotics to show noticeable effects. It can take a few weeks for your gut microbiome to adjust and for you to feel the full benefits. So be patient and consistent with your probiotic regimen. Research supporting probiotics. Numerous studies have highlighted the benefits of probiotics for older adults. A study in the American Journal of Clinical Nutrition found that probiotics improved digestive health and nutrient absorption in older adults, reducing the risk of malnutrition and digestive disorders. Another study in the Journal of Aging Research demonstrated that probiotics helped reduce inflammation and supported immune function in older adults, leading to better overall health. Furthermore, research in the British Journal of Nutrition showed that probiotics could alleviate symptoms of constipation, irritable bowel syndrome, IBS, and other gastrointestinal disorders, which are more common in seniors. Probiotics also help support the gut-brain axis, potentially improving mental health and cognitive function, as shown in a study published in Frontiers in Aging Neuroscience. By incorporating probiotics into your daily routine, you can improve digestive health, boost immunity, and support overall well-being as you age. Whether through supplements or fermented foods, probiotics can be a valuable addition to your health regimen, helping you maintain a healthy gut and vibrant life. Supplement 5. Vitamin B12. Vitamin B12 is an essential nutrient for maintaining overall health, particularly as we age. It plays a crucial role in supporting the nervous system, producing red blood cells, and maintaining brain function. However, as we get older, our ability to absorb vitamin B12 from food decreases, which can lead to deficiencies in a range of health issues, including fatigue, memory problems, and even nerve damage. Supplementing with vitamin B12 is a common and effective solution to address these concerns. Why vitamin B12 works. Vitamin B12, also known as cobalamin, is necessary for the production of red blood cells and the maintenance of nerve cells. It helps produce myelin, a protective covering around nerves, which is essential for the proper transmission of nerve signals. Without sufficient vitamin B12, nerve function can become impaired, leading to symptoms such as numbness, tingling, and weakness. Additionally, vitamin B12 is important for the synthesis of DNA and the production of energy within cells. A deficiency in vitamin B12 can result in fatigue, weakness, and anemia. As we age, the stomach's ability to produce stomach acid decreases, which makes it harder to absorb B12 from food sources like meat, dairy, and eggs. This is why older adults are more prone to B12 deficiency. How vitamin B12 tackles deficiency and supports cognitive function. Vitamin B12 deficiency can lead to various health problems, including cognitive decline, memory loss, and even dementia. Studies have shown that maintaining adequate levels of vitamin B12 can help preserve cognitive function in older adults. In fact, a study published in Neurology found that individuals with higher vitamin B12 levels had better cognitive performance and were at a lower risk of developing neurodegenerative diseases like Alzheimer's. Moreover, vitamin B12 is crucial for red blood cell production, and a deficiency can lead to pernicious anemia, a condition in which the body produces fewer red blood cells, leading to fatigue, dizziness, and shortness of breath. By maintaining optimal B12 levels, you can avoid the symptoms of anemia and feel more energetic. Praktiske tips for vitamin B12 supplementation. If you're not getting enough B12 from your diet, supplementation is a simple and effective way to address this. Here are some practical tips to ensure you're getting enough vitamin B12. 1. Consider vitamin B12 supplements. The most common form of vitamin B12 supplementation is cyanocobalamin, which is widely available in tablets, sublingual, under the tongue, tablets, and liquid form. If you have difficulty absorbing B12 from food, sublingual or liquid forms might be more effective, as they bypass the digestive system and are directly absorbed into the bloodstream. 2. Choose the right dosage. The recommended daily intake of vitamin B12 for adults is about 2.4 micrograms, but older adults may need higher doses due to absorption issues. For supplementation, dosages typically range from 500 micrograms to 1,000 micrograms per day, depending on the severity of the deficiency and individual needs. Always consult your healthcare provider for personalized advice on dosage. 3. Include B12-rich foods in your diet. While supplementation is important, it's also helpful to include foods that are rich in vitamin B12. Animal-based foods like meat, poultry, fish, eggs, and dairy products are excellent sources of B12. For vegetarians and vegans, fortified plant-based foods such as fortified cereals, plant-based milks, and nutritional yeast can provide vitamin B12. 4. Monitor vitamin B12 levels. If you're concerned about your vitamin B12 levels, ask your doctor to check your serum B12 levels through a blood test. This will help determine whether you need supplementation and guide your dosage. Deficiency can sometimes be detected early with blood tests, allowing you to take corrective measures before symptoms arise. Research supporting vitamin B12. Vitamin B12 has been extensively studied for its role in maintaining cognitive health and preventing deficiencies. A study published in the American Journal of Clinical Nutrition demonstrated that older adults who took vitamin B12 supplements had improved cognitive function, with higher levels of vitamin B12 linked to better memory and mental clarity. Another study in the Journal of Nutrition found that B12 supplementation improved energy levels and reduced fatigue in older adults, making it easier for them to engage in physical activity and daily tasks. In addition, research in the Journal of Clinical Endocrinology and Metabolism found that B12 deficiency is associated with an increased risk of neuropsychiatric disorders, including depression and anxiety, highlighting the importance of maintaining adequate vitamin B12 levels for mental well-being. By ensuring you get enough vitamin B12, either through diet or supplementation, you can support cognitive function, prevent anemia, and maintain energy levels as you age. It's a simple yet powerful way to enhance your quality of life and keep your mind sharp. Conclusion: by incorporating the right supplements into your daily routine, You can help support your bones, brain, heart, and overall health after 65. Vitamin D, omega-3 fatty acids, calcium, magnesium, probiotics, and vitamin B12 are all essential for maintaining vitality and strength as you age. Combining these supplements with a balanced diet and regular exercise will help you stay active, independent, and healthy. If you found this video helpful, don't forget to give it a thumbs up, subscribe to Health Every Day, and hit the notification bell so you don't miss any future tips. We'd love to hear from you. Share your experience with supplements in the comments, and let us know what topics you'd like to see in our upcoming videos. Stay active, stay healthy, and enjoy every moment with a stronger, healthier you.